Hi, I'm Dr. Mila Brujic, and welcome to the American Academy of Optometry podcast series. Today, we're joined with Dr. Valerie Baca. Dr. Baca, give us a little bit of a background on yourself and your history and your work experience.
Thank you. So I went to optometry school at the University of Houston College of Optometry. And afterwards, I completed a residency in ocular disease and surgery co-management at the Eye Center of Texas in Houston, Texas. I'm currently an associate optometrist at a small clinic up here in North Houston called Eye Physicians of North Houston. I am the only OD there. There's 4 MDs, and we do a lot of primary care and cataract surgery.
I think that makes you an expert in the topic that we're going to be talking about today. And that's really the decision point on whether or not to pursue combination surgeries, iStent with cataract surgery versus just simply going with cataract surgery. And that's the paper that we're going to be talking about today. Give us a little bit more of a background on the paper and what it actually looked at research-wise.
Well, as ODs, we are often monitoring patients with glaucoma, even if you're not providing perioperative care. So I do think it's important for us to be educated on the risk and benefits of these procedures that are available. Now, this specific trial evaluated the efficacy and safety of combined cataract surgery with the insertion of the iStent Inject device versus cataract surgery alone in patients with mild to moderate glaucoma. Now, the iStent is a type of minimally invasive glaucoma surgery or MIGS device that's implanted during cataract surgery and helps lower IOP by increasing fluid outflow. Now, this study aimed to assess outcomes over a period of 24 months. It looked at the number of ocular hypotensive medications, IOP, and comfort/quality of life ratings.
And I'm assuming too, it probably looked at safety outcomes as well too. Is that a correct assumption?
It did, yes.
So tell us a little bit about some of the key findings in the paper then, Dr. Baca.
Of course. So the primary endpoints were the number of IOP lowering medications and IOP at 24 months post-op. Now, the study did find that there was really no difference between the two groups, the group with the iStent and the group with cataract surgery alone. However, the patients in the iStent group required significantly less medications to maintain a similar IOP as the patients in the control group. So that was, really towards the iStent and showing how well it can work for some of these patients.
Again, that piece of the data was a little bit kind of confusing to me. Can you explain that a little bit more? Because initially you would kind of think that, okay, well, they both get to the same level of IOP, then you have the same efficacy in IOP lowering through just standard cataract surgery versus standard cataract surgery with the MIGS. But the results are actually a little bit more intricate than that because you are using less medications to acquire that. Talk about that a little bit more, what that actually means for patients.
Well, that really is key because, like you said, it's the same pressure. So there was no difference in the eye pressure. The really only difference was that there were less medications and they were able to keep that good IOP. Now, being able to discontinue medications is really useful to patients because that's, of course, one less thing they have to worry about. And then these medications do have a cost associated with them and potential side effects. So if we're able to come up with something that's safe and that gives them a good IOP reduction, then that's something that we should be looking into.
Were there any differences in the safety outcomes from the MIGS group versus the just standard cataract surgery group?
Not many difference in the safety outcomes. The iStent was noted to be a very safe procedure. It doesn't take too long and there are minimal complications. Now, they did measure ocular comfort using the Ocular Surface Disease Index, which is a questionnaire commonly used in dry eye, and the quality of life using the Glaucoma Activity Limitation Questionnaire.
And was there any differences between those two, or were they pretty similar between the MIGS group and the standard cataract surgery group?
Right. So both of these showed that the iStent reduced the needs for medications, but it did not provide a measurable benefit over cataract surgery alone in terms of vision-related quality of life or ocular surface comfort. Now, this just really suggests that the main advantage of the iStent is in the medication burden reduction and not an improved subjective visual experience or improved comfort. Now, this makes sense because it's very well known that cataract surgery by itself has the potential to improve the patient's quality of life by a lot. So, really, it's the medication burden that is reduced and not necessarily anything else that's affected.
MIGS is certainly a hot topic. With the outcomes of this study, do you feel that MIGS are really becoming the standard of care in combination with cataract surgery for those patients that are glaucomatous and requiring medications to reduce their IOP?
For sure. Now, iStent is not the only MIGS device out there. There are other devices and procedures that are commonly done today. And really what the patient ends up getting is usually up to the surgeon and, their evaluation, what they think works best. Every type of device and procedure does come with its own risks and safety profile. And some of these can be done without cataract surgery. So you don't necessarily have to wait for the patient to need if you think that it may benefit from MIGS.
Dr. Baca, this was very, very insightful. Thank you for really kind of decoding the paper here and really sharing with us the intricacies around this. I think this just helps us make better clinical decisions as we're referring patients and also educating them on what to potentially expect when they see the surgeon. Appreciate your time and thank you all for joining us on this episode of the American Academy of Optometry podcast series.
Thank you for having me.